Problems with the healthcare law go far beyond the troubled website. Welcome to HQ, everyone. I'm Allison Camerata.
Day to you. I'm Bill Hemmer. Welcome here. These physicians predicting some folks will lose their doctors and the quality of their care will suffer.
So joining us now is the congressman chairing today's hearing, Republican Darrell Issa of the House Oversight and Government Reform Committee. Congressman, thanks so much for being here.
Well, thank you, and thanks for covering this important hearing where we actually heard from healthcare professionals, real doctors who are seeing their patients cut out of seeing them.
So, Congressman, tell us what these doctors told you today.
Well, they gave us literal examples of decisions made by these insurance companies in compliance with the Affordable Care Act that are causing them to choose less expensive doctors and more limited scopes. And particularly one thing that I heard that I thought was amazing was that in many cases, a great many cases, the greatest institutions, if you will, the Mayo Clinics, the Cleveland Clinics of the world, are not in these plans. And they're not in these plans because they cost more, but they cost more because they're taking the sickest among us. They're taking the MS patient. They're taking people who their prescription drugs and other care cost a lot. That's part of what we were supposed to fix with the Affordable Care Act, was dealing with those with the most chronic conditions, and just the opposite's happening.
And Congressman, one of the people that you heard from today was a New York ophthalmologist, and she made a very compelling case because she's also a small business owner. So she has all of these employees, and she explained how in September she got a cancellation notice for her practice. And so she was guided to the New York State Exchange. She went on, and lo and behold, they can't keep their same doctors. They can't even keep, according to her, some of their same prescription drugs. So are you surprised that the Obama administration didn't foresee these unintended consequences that are happening to people?
Well, I think the administration did foresee them and felt that they were, collateral damage they could live with. But as many people don't know, when we hear about individual, we don't understand that if you've got 50 or less employees, which is the great many companies, you're really treated as individual. You're not treated as a large group. So this doctor with her employees who make enough money that they're not going to get subsidies, but not enough to afford these huge increases in care. And oh, by the way, now are offered only plans do not include their employer. In other words, the doctor can't buy a plan that she's included in from the exchange.
Yeah, it was so complicated, all the things she was saying, how her deductibles going up, her annual premiums are going up. So, Congressman, where do you start to help all of these people that you've heard from today?
Well, one thing we're going to try and do is we're going to try and unring the bell on some of these preemptions that are causing people to lose their existing plans. The president has said so. To the greatest extent possible, we're going to try and provide legislation to help that. But then we have to really attack some of the cost drivers and problems that already existed. One that came up in our hearings very loud and clear was part of the problem historically has been CMS, in other words, Medicare and Medicaid, and their under reimbursement. Some of our Democrats said just throw more money at it, and we're looking and saying, wait a second here, we have to find ways to deliver less paperwork and better care. That's something that we're going to try and work on, and we do begin to see a crack in our Democratic colleagues in which they're willing to at least consider reforming some of the mistakes made in the Affordable Care Act.
Congressman, one other important thing that came up this week, you have said that Secretary Sebelius is obstructing your investigation. How so?
Well, some of her subordinates have sent out specific letters telling contractors not to comply with our request for information. And the reason this is so significant is we're looking into the holes that were in the website on launch day, and they're saying don't give them the information. And we're trying to say, look, we don't have a problem not getting the information in open form, but tell us, are those loopholes still there? Are we still vulnerable? And the answer certainly is yes. Some of the vulnerabilities in the website on launch day that HHS and CMS knew about are still there, and that concerns us a great deal, and we can't afford a cover-up of vulnerabilities of your personal information.
See, her spokesperson says that the info that you're looking for would violate consumers' privacy. Very quickly, is that possible?
It's an outright lie. The fact is, what we're asking for is related to website vulnerabilities. MITRE Corporation subpoenas related to website vulnerabilities. This is basically a cyber question, has nothing to do with that, and they know it. They're being disingenuous. The fact is, if they have not patched these problems in the website, then they're telling people it's safe when, in fact, your consumer information, your private information is at risk today.
Congressman Darrell Issa, thank you so much for sharing with
Thanks,
us what
Allison.
you've learned today from that hearing. Thank you.
Also tracking some big problems with the Oregon Health Exchange, once touted as a model for the president's health care law.